Welcome everyone to the debut episode of Let's Talk Health. I'm your host, kam'mwamba. Today we're going to talk about HIV and AIDS. We, we are joined by a very special guest. May you introduce yourself?
Okay, my name is Chisomo Kapatira. I'm a nurse by profession
Yeah.
at Cholo District Hospital. Sure.
Thank you very much. So, can you start by describing what exactly do people mean when they say HIV?
Okay. If we talk of HIV, HIV is it's just a virus. Of course, it stands for human immunovirus, meaning it's just a virus that is transmitted to a person to get HIV/AIDS. So that's what HIV is.
So, can you tell us what exactly is AIDS?
AIDS. Okay. AIDS is just a lot of symptoms coming together. For example, somebody is suffering from TB, the same person diarrhea, the same person cough. So that's AIDS. That's why it is said AIDS is acquired immunodeficiency syndrome, meaning there are a lot of conditions that come together because the virus have suppressed the immunity of the person.
Uh,
So that's AIDS.
okay. So can you describe us the difference between HIV and this? Because most people think it is the same thing, but it turns out that they are two separate things. So can you describe us the main difference?
Okay. The difference is HIV is a virus that causes AIDS. Wow, AIDS is just a disease. It's a syndrome. It's like a disease that somebody suffers after the immunity has been suppressed. So that's the difference. Yeah.
So when a person goes to the hospital, they have tested. So what and we have found positive. So what does it mean when a person is HIV positive? What does that exactly mean?
Okay, if a person has HIV positive,
Yes.
meaning that in the blood system there is that virus that causes HIV AIDS. So it just means that there is a virus in the blood system that causes AIDS.
Uh,
Yeah.
so can you describe to us how is HIV and AIDS transmitted?
Okay, HIV and AIDS mostly is through sexual intercourse.
Yes.
Unprotected one, that is. Because sometimes maybe you can sleep with somebody using condom, but according to HIV and AIDS,
Yes.
it happens when there is no any protection. So the first one has to be unprotected sexual intercourse. The second one it can be maybe borrowing things like sharp objects. For example, razor blade, maybe sometimes maybe a knife you has to cut somebody and then also you have used it. That things can also transmit HIV and AIDS. The other one, though it's layer, is through like blood transfusion or sometimes through mother to child during maybe pregnancy, after during birth, even during breastfeeding. So those are the many measures that can somebody can get HIV. Sure.
So can you tell us as a someone that wants to get tested, what are the places where they can get tested or how can they get tested?
Okay. If someone want to be tested, the first I can go to the hospital. In the hospital, there are people that the counselors that they do HIV test. That's their work. Every morning, if you go to the hospital, there are specific people that are trained for that, almost maybe for 2 weeks, and then their duty is just to test. So you can go to any hospital like outpatient department, you can find somebody. Even in the wards, there are like Cholo, in the wards you have also. And other places like maybe we have campaigns whereby maybe we gather the youths at the maybe playing ground and then we counsel them about HIV and AIDS. They also get tested there. So it's almost all the facilities in Cho district, including other places where maybe we engage them. It's where we can test the HIV and AIDS.
So I have also heard that you can you can test for some homemade kits. So do you know anything about this?
Yeah, of course, I know self-testing,
Yeah.
whereby they have like a testing kit, and they use it, they dip it into the mouth,
Yeah.
so that at least now after some minutes, and then you get the results. Though I'm not familiar with I've never used it,
Yeah.
but I know it's happening in the district.
Oh.
Even other people, they go to the hospital, they got that test kit, and then they test themselves. Yeah, after being cancelled.
Mm.
Sure.
Oh, can you tell us what are the symptoms of HIV? How can someone know or suspect what maybe they have HIV?
Okay, the symptoms,
Yeah.
most of the times, maybe the first one, to be somebody to say that this one has HIV, the first one has to be tested. If the person is tested for HIV, we conclude that maybe this one is HIV positive. Others they can be immunosuppressed without getting HIV. So the first thing is somebody has to be tested positive. And the symptoms are as follows. Others they lose body weight, 10% of body weight, maybe within a month or two. Others they start coughing, others diarrhea. There are a lot of symptoms that they cut across. But you can't say that this is the only symptom that a person with HIV and AIDS can have. But the first thing has to be positive, and the loss of body weight, the diarrhea and the like. So there's no specific to say somebody with HIV and AIDS has a symptom, yeah.
Okay. So sometimes when somebody gets an HIV test, the results come back inconclusive. So what does this mean, and what happens when the results are inconclusive?
Okay, what normally happens, for example, if the results are inconclusive,
Yeah.
what normally happens, the person,
Mm.
most of the time, is she or he is told to come after 3 months to the hospital.
Mm.
If after 3 months the results are inconclusive, they do DNA PCR samples to the laboratory, where they confirm, they take the DNA of that person,
Yeah.
and where they confirm if really this person is really positive or it's really negative. So that's what the hospital does. But it takes steps. After every 3 months, you go for test. If the results are still inconclusive, then they take DNA sample. Yeah.
Kufuzira nawe.
So what treatment? So when a person gets sick, what are the normal treatments that we should go to?
Okay, we give it, we call it antiretroviral therapy,
Yeah.
whereby a person gets every month
Yeah.
antiretroviral therapy, long lasting one. It's, you use it daily, you take it daily. So the moment you are positive, the same day you start the treatment. And then also you are given the battery, and that vaccine also it helps at least to fight other infections, so that we don't want that person to suffer from it. We just want that person to be healthier as soon as possible, and he has to look healthier always. So that's why we give vaccine as well as ARVs. That's what we give.
So when a person gets HIV, what are the steps that they can take for them to stay healthy?
Okay, the states, for example, we encourage if a person has a partner, has to stick to that partner, and so that maybe he cannot get other infections from other people. So we encourage, if he has a partner, we encourage that person to have a faithful partner. And the other one, he has to take drugs daily without stopping, without sharing with somebody. If he has problems, he has to come to the hospital, so that person has to be assisted. And we understand also, we do viral testing, whereby we see the copies of the viruses that are in the blood system of that person. So that one also it helps us to say this one is taking the drugs normally, or this one is not adhering to the drugs. So that's what we do. But for that person has to take these measures. They are very important. And the other one has to use condoms daily if we want to have any intercourse with any person. Yeah.
Oh, so what what are the preventative measures but someone can take for them not to get HIV?
The preventive measures, the first one has to be abstinence. The second one, if it happens that abstinence has found, so we encourage safe sex whereby you have to use a condom, and others also they use PrEP. We have PrEP whereby a person gets ARVs before any intercourse or after intercourse with a person with HIV and AIDS so that he has to be protected. That's PrEP. And we have also PEP, which is the other one is PrEP, pre-exposure, and the other one is post-exposure. So we use both to give to a person so that he has to be protected from HIV and AIDS. But the first key is to be abstinence. Has to abstain, use condoms, use PrEP or post or PEP is also encouraged. And the other one, the one who is taking the drugs has to take the drugs consistently so that the virus has to, like, when it is a gone, is it gone? It has to be inactive always so that it cannot transmit to another person. Yeah.
Can you explain to us what services is available to a patient that has HIV?
I can say all the services are available. For example, they say the person can come for testing, can come for ARV drugs, can come for viral load. Even if she's sick for any other conditions related to HIV or not related to HIV, she or he can come to the hospital and get assistance. Have no problem. All the services are available for that person. We don't discriminate.
So can you tell us, is it possible for an HIV patient to have children?
Very possible, and those children can be unaffected. Very possible. We have a lot of them. That's why there's also a program whereby you call it prevention of mother to child transmission of HIV and AIDS. So it's possible for a person who is HIV positive to get pregnant and not to even to infect the unborn child. It's possible. Yeah.
So for a person getting tested or checked out, can you tell us how often should they go to the hospital to get the test?
Like for the one who is pregnant or not.
No, that like me, yes.
Yes.
I want to check if I'm positive or not. So how often should I be going?
Okay. If for example, we have two categories of clients. The other one, they are at-risk clients, high-risk clients. The other one are low-risk clients. For example, like maybe if I can be a sex worker, I'm a high-risk client because most of the times I sleep with men, right? So if I'm a high-risk client, so we encourage you at least every 3 months or every month you can get tested. But if you are a low client, you can be tested almost every year. Yeah, so if he, like me, if I am a low client, every year you can be tested. But if you are a higher client, almost every 3 months or every month, according to exposure you are engaged into. So,
Can you tell us if you do you know any laws that protect most people that have HIV?
and
Laws.
to protect people with HIV. Okay. And the laws, yeah, the laws, for the first one has to, the person has to take real drugs daily so that he can be protect others. The other one is the post-exposure, the one I talked about, and pre-exposure. Maybe I want to see with maybe you are HIV positive, and then I'll get the drugs. I'll get the drugs readily available because me, I'm negative. So I'll take the pre-exposure drugs daily, PrEP, so that I can be protected or somebody has to be protected. Yeah.
So do you know any misconceptions about HIV and how can you educate people about what's misconception?
there are a lot of misconception. Other people, they think that maybe even the mosquito can transmit HIV and AIDS. That's a misconception. Others, they say if your blood is all, it's difficult for you to get HIV and AIDS. That's misconception. We don't know how true is that. Of course, the research are underway, but we did not, as the hospital, we did not come to the conclusion saying that if your blood is O, that means you won't get HIV. We don't have that research as of now in the country. So people are doing research to find out. So there are myths. If you are O positive, there are myths that you cannot take the HIV and AIDS. That's the misconception. So there are a lot of them that is happening in the country. Even others, they believe that if maybe I sleep with a young person, if I'm HIV positive, I'll get healed. Others, they believe that. On top of that, even others, they say, if maybe, of course, we know God heals, and it's perfect. But others, what they do, they receive the information from other people, saying if you prayed, that means your HIV will be gone. But they forget that they have also the responsibility to go to the hospital to get tested so that they'll be confirmed HIV negative. So there are a lot of misconceptions outside there. So people have to know the real information in the district.
Okay, can you explain how a person with AIDS can maintain a healthy lifestyle?
Okay, a person with HIV/AIDS can maintain a healthy lifestyle. The first one is taking drugs daily. That's the healthy lifestyle. The first one. The second one, at least has to take 6 food groups. We know we are Marians, we have little on the table. We are poor, right? But at least we recommend that by the end of the day, at least 4 food groups has to be taken by that person. It's nutritious, right? So if that person is getting nutritious food, at least that person can maintain a healthy life. The other one has to abstain from sex. If if you want to do sex, it has to be protected one. Use condoms daily. That's the best that you can maintain your health. And also you have to consult a doctor if the person feels he or she is sick. Always seek the medical help, not from other people. Because others they go to which maybe the herbalist, but the herbalist, the scientific rationale of the drugs, they don't know. So we have to at least to maintain health, they have to seek the medical help, whereby there's the scientific rationale for doing other things. Yeah.
So, can you tell us which is the most vulnerable group but they can get HIV?
The most vulnerable group that they can get HIV, the first one is the children, at least 0 to 12 months to 24 months. They're at risk, that's the vulnerable group. They can take HIV and AIDS. The pregnant, because the pregnancy itself, it makes somebody the immunity to go down. Those who have suffered TB, they are the vulnerable groups as well. The prisoners, even the prostitutes, they are the vulnerable groups that they can get HIV and AIDS.
Can you tell us how mental health support such as counseling is helpful in managing what people that have HIV?
I think counseling has helped a lot of people, especially those with HIV and AIDS, because we can see that nowadays societal thoughts concerning HIV and AIDS have decreased. So this has helped mentally to people with HIV and AIDS, as well as even the discrimination and the stigma discrimination has also decreased due to the counseling that we do at at the hospital. That's mentally. Somebody have to walk to do things. It's mental. So we have seen that it has helped a lot in the district when you talk of counseling to clients. Even the other people, like we understand we have also postpartum blues, whereby maybe if a person has HIV and AIDS, maybe she or he was refusing to breastfeed a child. So nowadays we have seen that thing have declined because people have information and know they're supposed to do. So that's that.
We can address the stigma and discrimination that the person with HIV faces.
Okay, I think the first one, people has to have the information at the community, how they can prevent somebody, how can they get the disease, and the second one, how to prevent the HIV infection in our community. So if people have information, it's easy to avoid discrimination and even the stigma as well. So people has to have that information first. And also the other thing is the community can end this discrimination and the stigma whereby involving them in the services, like in the community, you have to involve them, the community engaging with them. When they are providing the services to the community, they have to be there. They have to know what you're doing at the hospital. You can have the male champions, you can have the mother groups. Those people, they can help us to end this discrimination and the stigma. And as of now, we can see that even if somebody has HIV and AIDS, discrimination is low now. At least the people, they are able to eat with somebody with HIV and AIDS because they have the information. So it's easy to hope to end this discrimination. And it's very easy because we have a lot of information in the district. We have a lot of information in the community, and the people, they are aware of everything. Yeah, so this, we see that by the end of maybe 2030, the stigma and the discrimination will end, for sure.
Thank you very much. Thank you for joining us on this discussion. And with that is I hope you all learned the very important things about HIV and AIDS. This I've been your host, kam'mwamba, and this has been the very first episode of my new program, Restore Health. And I hope we will see you again on the next episode.